our next speaker is Ms. Eisiah Abbas. She will talk about ostomy care and complication management. Ms. Eisiah is a senior wound and ostomy and diabetic foot specialist nurse at King Abdulaziz Medical City National Guard. She is the first Saudi nurse earned a master's degree in skin integrity and specialized in ostomy care. Welcome, Ms. Eisiah.
Bismillah, salatu wassalam ala Rasulillah. Thank you for my colleague from King Abdulaziz University Hospital for giving me this opportunity to be a part of this great conference. And thank you, special thanks for Prof. Nasser Astani and for Dr. Khalid Risaini for teaching me in this field and supporting me a lot. My presentation today about ostomy care and complication management. Okay, all of us knows that ostomy surgery affects physical, psychological, and emotional life for the patient and his loved ones. And it's expected from us as a clinician to help this patient to adapt with his new body image and to live better quality of life. Between the major types of ostomy surgeries, we have to give a special attention to ileostomy because it's life-threatening, and we have to give special consideration for high-output ileostomy. The importance of the role of the ostomy care nurse. Ostomy care nurse, she is the one who's providing holistic assessment for the patient, and she's the one who's doing preoperative education, stoma site marking after dealing with the physician, post-operative care and management, and she's always managing the complication and following the patient for the rest of his life with the stoma and minimizing his readmission for stoma complication treatment and reducing the cost of the organization. Aspect of stoma management should include the normal stoma function. We should explain it very well to the patient and to the caregiver, and the type of ostomy and the appliances of they will use it and how to apply it and remove it easily without damaging the skin. Caring for the stoma and peristomal skin. Obtaining the supplies is a big problem in most of the organization. We have to help them in that. And storing the supply also another big problem when we have very humid weather. So we should instruct them to keep it safely. They should recognize the complication and deal with it first before approaching the hospital. The summary of the World Council for Interstomal Therapy guidelines recommended that each patient going for stoma surgery should go for preoperative site marking. And it's important for elective and non-elective cases. And it should be performed by a specialized consultant or trained doctor or ET nurse if the hospital has an ET nurse trained in stoma siting. Patients also should receive proper education, and they should taught how to protect the skin and how to perform and keep better quality of life after stoma surgery. What is the most common complication? A lot of literature and studies concluded that bad stoma siting and flat and non-protruding nipple is the first complication the patient will face after stoma surgery. And we see it a lot with our patient. Imagine if the patient is stoma sited inside this abdominal folds or near to the umbilical line and near to the suture line, how he will manage it after that. I'm sorry for some pictures. With this patient with high output ileostomy, if there is bad stoma siting and bad protruding nipple, he might experience all this situation with the leakage of the stoma. So we should be careful about stoma siting. In stoma siting, we need to consider many things. First of all, we need to consider the patient body weight. And after that, we have to be 5 centimeters away from umbilical line, skin folds, scars, bony prominence, and belt line, with a special consideration to put the stoma to be supported with the rectus muscles. And then after that, we need to look at the patient occupation and work and lifestyle. Special patients, they cannot wear the seat belt if the stoma sited in the seat belt area. And also, if the patient is chair-bound, we have to consider that, to give him the easy time and the easy way to take care of his stoma. Peristomal skin is always occurring with the patient with having a stoma during a period in his life with the stoma, and it's considered to be there in the first 5 years until the patient adapts. And with proper education, we can reduce that. This is a kind of very healthy skin, very well-sited stoma, and intact peristomal skin. When the peristomal skin is affected with the appliances or leakage like this, so it will be hard for us to fit the pouch, and it will be hard for the patient to manage his stoma. So the goal of skin management in patient with the stoma to decrease the possibility of skin breakdown and to initiate the protective measure even before the patient come out from surgery by applying the skin barrier spray after finishing the surgery and putting the pouch for the patient. There is a lot of complication in the stoma and in the peristomal skin. The patient might develop one of it. Some of it is early and some is late. From the early complication, I choose stoma necrosis, when the stoma become black and dusky because poor blood supply reaching the nipple of the stoma. In this case, we need to examine with this tube to see if the necrosis is superficial, so it can be dissolved after a few days. But if it's deep, the patient needs to go again to OR and for refashioning of new stoma. Stoma retraction also, when the stoma retracted and become very stenosis, also it might need refashioning also. Ostomy prolapse, one of the late complications, was when the stoma will protrude out of the abdominal surface, and it requires special attention. Stoma accessories, actually it's not accessories to the one who is giving the care of the stoma patient. It's vital things to keep the skin healthy and to hold the stoma in place. So we should consider to use this, especially the skin protection and the adhesive remover. A kind of peristomal skin complication, it's irritated dermatitis when there is leakage around the stoma. So first thing, we should determine what is the cause of the complication and treat it. Some patients, they can develop also reaction to the material of the skin appliances. In this case, we should know what is the material causing this reaction and change the company, the material from another company. It's like this. Sometimes the patient will develop granuloma also from the back rubbing in the stoma edge or from the effluent. We have to consider that and do silver nitrate cautery. Sometimes the stoma will have separation. In this, if small separation, we can treat it with powder and spray. If becoming big, we can treat it like any wound bed and then apply the pouch on the top of that. If very huge and it went down inside the abdominal cavity, we should take the patient to OR. Sometimes the disease-related problem will appear around the stoma, like in bioderma gangrenosus. We should treat the wound bed like any wound bed and then provide a flat surface for the pouch to fit. We should differentiate between fistula complication and wound complication. After that, deal with it. One of the common complications for patients with urostomy is the urine crystal formation, which is very painful when the crystalline deposit around the stoma, and it needs a special treatment and attention. My take-home message to our respected doctor that please give me a properly sited stoma with proper protruding nipple to help me to improve my quality of life and to save the time of the ostomy care nurse. Thank you so much.